Good evening, good morning, good afternoon, depending on where you're hearing this from. It might be a different time of the day. My name is Dr. Maria Akani. I'm a mental health consultant and I have a master's in psychiatry, a master of science in clinical neuropsychology, and I have a first degree in medicine and surgery. I am speaking to you also as someone who's concerned in the mental health space. I'm the managing consultant of a company called Renaissance. And from our clientele, we have noticed an increase in the amount of anxiety that has been going around due to the threat of COVID-19. And we now know it is worldwide. It's affecting everyone in one way or the other. And so we thought that it would be good to have this discussion so that people can be aware of why they're going through what they're going through and some of the things that you can do to help you manage this anxiety. So, as I said earlier, we are talking about managing COVID anxiety. And we will start by basically defining what anxiety is. So anxiety refers to the fear and nervousness and unease that comes because of a threat of danger or possible danger. Just a minute, my slides are a little bit stuck and not moving. Okay, so this is the outline that we're going to follow. And the first one is what is COVID anxiety and why anxiety happens and what is causing anxiety, what you can do about it, and really answering the question whether the anxiety you're experiencing is normal or not. So what is COVID anxiety? We'll start by defining what anxiety is. And like I was saying, anxiety refers to a feeling of worry, of being nervous, of having a lot of fear and unease about the situation, which is possibly going to have a negative outcome or has definitely has a negative outcome along the way. And in this case, we are calling COVID anxiety something that relates to the feelings, all these feelings of worry, the unease, the fear that comes that is pertaining to the current situation about the COVID pandemic, COVID-19 pandemic in the world. And what is causing this anxiety? So there are several things really. The first one is the fearful news. The continual influx of news, horrific stories about hospitals being crowded, running out of supplies, patients running out of medication and support, close people, relatives, and people that we may have heard about that are famous having either died of the COVID infection or have been terribly affected by that. So the news has been fearful. And just from hearing fearful news, you can get a lot of anxiety about a situation. Also, the disease itself, knowing what the disease can do, knowing the impact that it has had, knowing that it can actually claim a life. It's one thing if someone gets a disease and they are morbid, like they're not able to function, they're not able to go about their day to day. But to think that people's lives are actually being lost, that can bring a lot of anxiety because a lot of us are not ready to die. even if we do know that we're going to die one day, there's just a whole lot of things about life and death that brings a lot of anxiety. Then also staying at home and being idle also increases anxiety, because once you're at home, your mind is not occupied, and it's easy for you to then have all these worries uninterrupted. So being at home, not having a lot to do, sometimes not having a sense of purpose, all those things can actually make somebody have increasing anxiety. Then knowing the experience of others, yesterday I just had a horrific account of one of the doctors in New York, and he was explaining his own experience about COVID infection, and it was terrifying. And so he explained it in detail right from day one, how he was feeling and so on. And he recovered from it, but even though he recovered from it, it was really a terrifying experience. And listening to the whole account of it can be really difficult. I think another thing that's also difficult is actually knowing my close family. For example, my sister-in-law is working right in the ICU and currently dealing with people who have COVID infections. So that already just also can be very, very terrifying. Then also the major life change with lots of uncertainties. All of a sudden, you have to start learning to work at home. You have to minimize movements. You have to make do with whatever resources at home. You have to become a teacher. You have to learn how to clean your own home. And there's a whole lot of things that just um, make a difference, that have just become different in our lives and bring uncertainties, and not being certain can take away a lot of anxiety. Then there's a threat on business or employment. And this is constant because day by day, I'm hearing of different businesses that are closing. Just this evening, a close friend of mine told me how she yesterday had closed shop, gave the keys to the landlord for her business and just closed shop because it just wasn't viable anymore. And so the threat on businesses is quite big. But apart from that, that means also the threat on employment. If your job cannot be done remotely, then there are questions as to how you can continue earning a salary when you are actually not working. How does production keep happening of different goods and things? And so all those things constantly bring anxiety to us. Also, if you have an underlying physical condition or know someone who does, reports keep coming out more and more about comorbidities and how the condition can be more severe when a person has comorbidities. So already having an underlying condition or knowing that, close people that you love are experiencing physical conditions can also bring anxiety. So one of the things that I remember someone talking about was how that, yes, it's mainly the elderly, but then which one of us is not related to the elderly? There are still people that are close to us. There are people we love. There are people we're not ready to lose. And so anxiety can also come from just thinking about our loved ones or thinking about ourselves and so on. Also, we have those that may have underlying mental health conditions. So having an underlying mental health condition can actually worsen the anxiety, because if you already have general anxiety disorder or you have health anxiety, if you have panic attacks, this is definitely not a great time for you, because then the anxiety is already available, so to speak. There's free floating anxiety and there's constant feeding of it, like constantly every day. we keep receiving more and more of this news and so on. So that's another thing that can affect a person having underlying mental health conditions. The other thing that causes anxiety is having no end in sight. Right now, we are being told the virus, the pandemic is yet to peak. And apart from that, once it does peak, there will be a slump a little bit. We will flatten the curve, and then it's expected that the curve will again go up later in the year. So it is not clear when this will end, and it makes it very difficult to plan in economies that are cash economies, like the country I come from. It becomes very difficult to do bulk buying for months on end and think about how you can stay home and not be able to get out of the house. It's just very difficult. So this is just a simple thing that I'd like you to reflect on. And a number of us may have been experiencing some kind of anxiety one way or the other, and so on. And so there's a little table just for your own self-reflection. Ask yourself, how COVID anxious are you? So maybe you have no anxiety. And if you have none, I want to think that perhaps you're in denial. You may have mild anxiety, mild to moderate. It may be moderate, moderate to high, or it can be at its highest. And obviously at its highest, I'm expecting to hear things like insomnia and restlessness and so on, poor concentration, but we'll talk about that a little bit later. So just take some time to really think about, how anxious are you yourself? What do you do about this anxiety? What do I do about my anxiety when it does come? What can I do about it? So the first thing is acknowledge it. It doesn't help to pretend that you're not experiencing any anxiety. It's oftentimes in times like this, you want to look like you're all together, you're in control, and so on. So yes, you can try and put a front for other people, but acknowledge it for yourself, because when you acknowledge that this is what is going on, then you're more likely to actually deal with the problem. The second thing is, do not feed that anxiety. So there are constant messages going around WhatsApp, videos, audios, news, elaborate images of what's going on, horrific stories, and constantly feeding on this news and so on will just increase your anxiety. What you need to do is really limit the amount of news you get. Focus on making sure that you only listen to reliable sources, and give yourself a time when you can listen to updates, maybe once a day or something. But if you're constantly listening to these horrific stories, it's not possible to listen to it without feeling your heart skip a bit. So when you do that constantly, it's like you are assaulting your mind and heart persistently. And then also, some of us have the tendency to have elaborate imagination about these things. Hold your mind, stop it. Don't let it go boundless, imagining how much worse things can be. Yes, you need to plan. Yes, you need to think about the future, but that doesn't mean that you allow your mind to go wild in imagination about how bad things can go. That's usually the first place we start from, even when we're dealing with therapy, trying to control how you think, okay? Then keep occupied. So one of the methods we use in managing and self-care is called the ACE model. And in the ACE model, the first one is achievement. So every day you have to look at this ACE model. In a day, think about something that you can look to as an achievement, okay? Whether it's something that you are reading a book, reading an assignment, reading an article that perhaps will help you with your career, or self-help in one way or the other. Write something. So when I'm talking about achievement, I'm not saying that you need to do all these things that I've listed here, like write, learn, get gardening, clean. I am just giving examples of some of the things that can give you a sense of achievement after you're done doing them. So sometimes writing, it could be writing short stories, writing a blog, writing a book. It could be learning a new skill. And right now, there's a lot of options about learning online that is going on. And if you thought you couldn't do it, well, now you can see that it's actually possible to learn online. The other thing is things like gardening, physically doing something, cleaning, they can give you a sense of achievement. And all those are important in boosting up your mood and also managing your anxiety. The next thing is connection. Connection is very important. Uh, One of the things that I have been saying is that social distancing and quarantine doesn't have to be equivalent to isolation. So you can still reach out to someone. Make sure that every day you connect with someone. Connect with someone who cares about you, someone who loves you, someone who makes you feel that you matter. Because these are the things that then make you have purpose and give you motivation to go on. They also make you feel good, which means that they help you lower your anxiety. And the E on the ACE model is enjoyment or enrichment. So do something that you actually enjoy. Listen to some music, dance perhaps, cook, try out a new recipe, watch something that you like, but trying to make sure that every day you tick one of those boxes. One on achievement, one on connection, and one on enjoyment. The other thing that you can do is journal. So a number of people, especially males, kind of protest the idea of journaling because what if somebody reads my thoughts? What this idea of being able to write down what you think. But journaling is a way of doing some kind of self-therapy. It helps you express yourself, analyze yourself, and look at yourself in an objective manner rather than being subjective. So when you're journaling, you need to be able to get deep because it's for you. And if you feel you can't use a book, perhaps you can use an app or you can use a laptop and truly express yourself in that journal. Be open and talk about how you feel, the questions that you're asking. Why was today feeling like it was a waste? Or why was today feeling very meaningful? What did I do right? Why does that person make me feel insecure? Just being able to ask yourself hard questions that will make you self-reflect and manage yourself better. The other thing that you can do now during this time when there's been a lot of anxiety is just maintain a routine. So exercise is important. Exercise will help you keep your circulation going. It will help you keep fit and healthy, which is what you need in preparation for your body's defenses against the COVID-19. But apart from that, it will also elevate your mood, which, because when you exercise, endorphins are released in your body, and that also helps elevate your mood. I also put groom there because there's a sense in which when we groom ourselves, we also feel good. So the stay at home doesn't really help. Most times when we have to stay at home and work at home, then we don't really care about how we look. We don't really care about whether we wear the right clothes or spray ourselves and do our hair. But those things also have a way in which they give us a bounce in our step. And so, as much as possible, still wake up in the morning, still get yourself dressed and looking good, still get yourself positive so that you can carry the day really. And even when you're maintaining a routine, have some kind of a timetable. Have a wake up time that is consistent. Have break time that is consistent. So whether it's a time when you have breakfast in between your work or meal time at lunch and so on, and have a knock off time. It's very easy to have no boundaries if you're working at home, which can make you feel more tired and exhausted because you're not changing spaces, which is something that you get to do when you go for your regular work at the office. But aside from that, working at home can also mean that you feel very disorganized, and that can worsen the anxiety because there's no order. So it's important for you to designate a workspace, designate an area where you can be doing your work, and make sure that you maintain a routine. So the next thing I would like us to talk about is whether your anxiety is actually something normal or something that can be overwhelming and you probably need some extra support. One thing I want to say is how that at this point in time, anxiety is the default for everyone. Everyone is anxious about one thing or the other, when kids are going to go back to school, whether the education plan will continue the way it should, whether the COVID-19 is going to affect their families, whether employment will still be there, whether businesses will continue. There's just a lot of anxiety going on. So having anxiety at this point can, in inverted commas, be considered normal. However, it's important for you to know when you need to get help. And one of them is when you have insomnia. Insomnia is a disruption of your normal body systems. And so if you're not having adequate sleep, it means that, first of all, it will affect other systems in your body. Your sugar regulation will be affected, your mood will be affected, your concentration, your immunity gets lowered when your sleep is poor, and so on. So if you're having insomnia, that's something that needs an intervention. You have to act on it. If you notice that you're drinking or smoking regularly to calm yourself down, that is something that may require an intervention. Okay, so I'm saying may require an intervention because it depends on how often you're doing it. And if you find that you actually cannot function unless you get a drink or smoke during this period of time because of all the anxiety you're feeling, that's a clear indication that you need an intervention. Okay. However, the fact that you may still function even after you do not drink or smoke does not necessarily mean that you may not need an intervention. What is also important is to consider what actually happens during the time when you do drink, like binge drinking, for example. If it gets to a point where it brings about disorganized behavior or violence and so on, then you definitely need to have an intervention on that. Also, if you're constantly having sweaty palms, tremors, discomfort in the abdomen, sometimes to the point of having a running tummy, you can constantly feel your heart racing, then you know this anxiety needs to be put under control. The problem with constantly having these kinds of symptoms, it means that your adrenaline is high in the blood, and having a high adrenaline is good for the short term, but over time, it will compromise several functions of your body. Okay, so already it means your heart is overworking, and it also means that your blood vessels are constricting, possibly your blood pressure might also be high, and so on. So that needs to be managed if that is what is going on. Also, having frequent unexplained dizzy spells or feeling faint is also an indication that your anxiety is becoming serious enough to require an intervention, because that means that you're now getting to a point where it's compromising your focus. Having panic attacks, person experiencing breathlessness and so on, all those things can also indicate that you need an intervention. Panic attacks are disruptive. You basically can't do anything when you are going through this breathlessness and panic, because you just feel like you're about to die and you're running out of breath. If you have trouble concentrating or thinking about anything other than COVID-19 and its effects, that is also an indication that you probably need an intervention. And if you have profound debilitating sadness. Now, an intervention doesn't necessarily mean that you need medication. An intervention can also just mean that you just need to talk to a therapist or a counselor and so on. At this point, if there are any questions, I think they can be typed in. They can be typed in. I'm not sure if someone can ask a question. Yes, you can also ask a question if you have any questions at this point. Yes, Natasha, go ahead with your question. Yes, Maposa, you had a question. You can go ahead with the question. You're also free to type the questions if you're unable to speak. Okay, so there's a question about what my comment is about self-medicating. I have, of course, there are different kinds of things that people use to self-medicate. Some of it is alcohol, which alcohol itself worsens anxiety. So initially, people feel a lot more calm and they feel that, you know, they can They actually feel better when they've taken the alcohol. But what then happens is that in the end, the person then experiences worse anxiety after that. And that's why we have what we call alcohol-induced anxiety disorders. Okay, so there's another question here. It says, I mentioned drinking and smoking as some of the habits that would indicate anxiety. What about gluttony, always eating, seeing that you're under quarantine due to COVID-19? So there is actually such a thing called actually such a thing called comfort eating. And when a person does comfort eating, it's partly because of anxiety. So that can also be an indication of anxiety. Actually, there are a number of other things that can indicate anxiety. There's what we call regression, where a person starts biting their nails again, even though they didn't bite them for the longest time when they were growing up. Thumb sucking, and sometimes you also see bedwetting, which is rare in adults, but sometimes can also happen in children. So the symptoms of anxiety are actually varied. I just tried to talk about the most common and also some of the most harmful. So gluttony is not immediately harmful because it takes some time before people become obese. But smoking and drinking are almost immediate with their effects on our bodies, but both of them are really important to be concerned with. Thank you so much for your question, and I'm glad that it gave us the opportunity to talk about this. Sorry, I'm not sure at which point my mic went off. I hope I was able to tackle the questions. I answered the question on drinking, on self-medicating, and I talked about drinking as one of the ways people use to self-medicate, although sometimes we also have some other types of self-medication, like people actually buying their own anti-anxiety medication. And the trouble with that is that you don't have a history that has been taken by the doctor to understand whether this medication is actually good for you, whether it can interact with any of the other medications that you take, whether you can have side effects, whether it can be addictive, and so on. And most times people don't know the side effects of these medications and whether they can react to them. So self-medicating is not advisable. At all costs, make sure you, as far as it depends upon you, don't do it. And then the other question was about whether gluttony was also an indication of anxiety because, under quarantine, people have been eating more than usual, especially that I talked about smoking and drinking. And I did admit that, yes, indeed, that can also be a symptom of anxiety because in those kinds of things, there's such a thing called comfort eating, where people eat just to feel good, to have that feeling of satiety and so on. And so it can actually be a point that it can actually reach a point where it can be a danger. Okay, so if there are no other questions, you are welcome to get in touch. You can reach us using any of the numbers that are available on the screen. You can either WhatsApp, text, or you can also call, and you're also welcome to email the address that is shown on the screen. And you can also just comment on the event page, ask any questions that you had that you felt were not answered, and so on. Or if you were going to listen to this recording later, you're still welcome to ask your questions, and we hope we can answer all your questions. Thank you very much for your attention. I hope this has been helpful for all of you, because we really want to make sure that all of us are supporting one another during this time. It's been wonderful to be able to support you through this journey, and I hope you can share some of the tips and knowledge that you have received today with as many people as possible. As much as possible, it would be good for all of us to be able to help and support one another. Thank you so much.